Okay, I am here in the room with Mr. Ivan Emoto. I'm getting ready to call the doctor. So I'm gonna call the doctor, ring ring. Hi, my name is Sarah. I am the registered nurse taking care of Mr. Ivan Emoto here in room 148. Just so we can be on the same page with the same patient, I have patient Ivan Emoto. His date of birth is 12/1, 67 years old. He does have allergies to penicillin, cephalosporin, and midazolam. And I'm gonna read you the MR number 8196375. Okay, so just a little bit about Mr. Emoto here. He was brought in to the hospital due to his chronic heart failure exacerbation. He had stated that he has not taken his water pills in the last 5 days, and he also states that he has been out of his heart pills as well. Just going over some of my assessment findings and the reason why I'm calling. He does have a productive cough. He is coughing up 15 milliliters of white thin sputum. Going down and listening to his lung sounds, his breathing was labored, and also I did hear some fine crackles in the lower lobes of his lungs. The patient also stated that he has not voided since 8 hours ago, and it was less than 100 milliliters. It was dark in color, cloudy with a strong smell, and the patient stated that his frequency decreased as well. Just going over some of his vital signs, temperature was a 98.8. His blood pressure was a little elevated. It was 158 over 79. His heart rate was 99, and also his O2 sat was at 89% on room air. But I did go ahead and raise the head of bed and titrate oxygen to increase that O2 sat up to 92%. Also going over some of his assessment findings, I did palpate +3 pitting edema in his lower extremities. His dorsalis pedis pulse was a +1, and his posterior tibialis pulse was a +1 too, probably due to the extensiveness of the edema on his lower extremities. Just going over some of his lab values that I have right here with you that were a little bit concerning. Okay, so his hemoglobin is 11.5. That is a little bit decreased, probably due to anemia, to shortness of breath, or a little bit of vitamin deficiency. His hematocrit was 35.1, which is also decreased a little bit, probably due to the same thing, anemia due to the shortness of breath, or some vitamin deficiency going on there. What I am a little bit most concerned about was the white blood cell count. It was at 11.9, which is increased, which could be due to an infection or possibly some pneumonia going on. The other one that I found was abnormal was his BUN. It was a 6, which is a little bit decreased, and it was probably due to the excess fluid that's hanging onto his tissues. I want to recommend a sputum and a culture and sensitivity test on his sputum, just so we can kind of rule out any impending respiratory infection or possibility of pneumonia. Okay, so at this point, I would listen to your order. So I would need to get a culture and sensitivity test done on this sputum stat, and I would repeat that back to you. So we are getting an order for a culture and sensitivity test on his sputum stat. Okay, thank you.